Replacing a missing tooth with a dental bridge requires unnecessary cutting and grinding of healthy neighboring teeth to support the bridge. Within 3 months, 30% of the bone is lost, and it continues to atrophy below the bridge, leading to gum recession. Plaque and debris accumulation below the bridge may cause gum inflammation and decay of the supporting teeth. Decay may progress unnoticed, leading to an apical abscess at the tip of the supporting teeth, possibly causing a fracture. A flipper is a removable option for replacing a missing tooth. Again, bone atrophy or shrinkage continues below a flipper, causing gum recession, plaque accumulation, and adjacent tooth decay. A Maryland bridge is another fixed option to replace a missing tooth. The winged extension of the bridge may easily detach or debond, requiring repeated bonding. Bone loss continues, and plaque accumulation again may cause gum inflammation and decay of the adjacent teeth, thus leading to possible failure of the bridge. The standard of care for replacing a missing tooth is a dental implant. Dental implants maintain bone and gum levels. And neighboring teeth are not destroyed. Dental implants feel and function like your own natural teeth.